Okay, apologize about that. All right, so dealing with different ball and socket joints. Again, anytime you have that area in here where you get a rounded surface across this area, this is done by a capsule. Another one that we're going to be dealing with is that acetabulum, or the articulation between the femur and the pelvic girdle. So those are going to be some of our main rotations. So knowing all of these different articulations is going to be important. Another type of articulation we're going to see is the intervertebral articulations, or basically that vertebrae. And the vertebra, we have the hard bony surfaces that we talked about, and then we have these intervertebral discs. We have ligaments that are attaching all along in the spinous processes and that. And so this allows some flexion and extending back and forward, as well as side to side motion as well. And it's because of these discs and we get those motion. These are also areas we can see with a lot of weight bearing, we can get damage to these discs where they can pop out, be damaged, all sorts of things. So that's another articulation that we're going to see. But one of the things we can get is a herniated disc, or basically because of the pressure on that disc will actually herniate and push out and can cause a lot of damages and injuries. When we're looking at that shoulder joint, again, here's a look at that. So again, we call this a ball and socket because basically this is how it looks. Even though these bones are separate on the scapula, here's the clavicle tucking in, different type of ligaments and tendons all attach around this area, and then you'll get your rotator cuff and your capsule will enclose this entire area, and you get some synovial fluid that's going to be inside of here. Here's your joint capsule that comes all around. And then you've got your bicep tendon and your tricep tendons that will come up over these areas as well. So that's going to allow that motion of that shoulder joint where you can get circumduction, flexion, extension, and all those motions. Again, talking down to the elbow joint, talk here, this is going to be that hinge, synovial fluid around here, and there's going to be a capsule that's going to be coming across that area, as well as all your triceps, your biceps, tendons, everything is going to be coming down here, as well as all the muscles in your arm. And again, I'm not worried about you knowing all these specific names and portions of the bones themselves as far as articulations there. Once the other one we get to is going to be the hip joint, and I talked about this well, also being a ball and socket with the acetabulum. And again, here's that capsule I talked about that's going to be coming from the hip, the pelvic girdle when I say the hip, from ischium and ilium there, and then comes over and goes around the greater trochanter and the lesser trochanter, and then fills this area. So again, when we talk about a hip fracture, it's going to be right here through the surgical neck of the femur. Synovial fluid is going to be floating through it here, and other different ligaments just going to be holding that area together. So when we look at it from the outside, this is just a really thick capsular area with ligaments that come across and really holds this area tight. And so when, again, we get osteopenia, osteoporosis, weakening of the bone, this capsule will actually hold up more so than the bone will. Vice versa, on stronger bones may hold up more than the capsule. So that's the difference between where we see dislocations and tears there versus actual fractures. Now our joint with the most flexibility, the most ability for articulation, and also the most for injury is going to be the knee joint. So I talked about it as well, and we get this rotation we get flexion extension of the tibia on the femur itself. This is a nice articular cartilage surface. Different type of cartilages, and we'll get into that a little bit later, but this is a nice gliding motion. And inside there, you're going to have your medial meniscus, you're going to have your ACL, your PCL, medial and collateral ligaments. And these are all going to try and hold this knee stable so it only moves in a flexion and extension motion. You can get some side-to-side twisting here, light, but that's not really the motion we want to do. And when we get those abnormal motions, that's when we get big injuries to it. Here's a side view of it again, of the distal epiphysis of the femur. Here's where I talked about that gliding motion of the patella that comes down and moves around with that knee, and it slides as we move here. So all these areas are going to be holding in with the muscle, and then the ligaments and the tendons coming around on each side to make that knee as stable as possible. So those are going to be the main components on there. That's where I want to look at. Again, our bones work with everything, and we're going to talk about. So our bones are going to be our main structure like we talked about, but those are going to be integrated with our muscular system, which is going to allow it to move when I talk about skeletal. Our cardiovascular and our lymphatic system is going to be working with those as our bones produce blood and nutrients and other things like that. And then growth in that is underneath the endocrine system. So that is our skeletal lecture today. Hope that's worked out good for you, and we'll be talking with you guys soon.